Hello everyone. Today I am going to talk about abnormal EKG rhythms. I have already done one video on a normal EKG, so you can refer to that video also. So let's go ahead and start with this topic. Good morning. Today we are going to talk about the normal rhythm and abnormal rhythm. So let's start with our conduction system. So this is a conduction system. In a conduction system, let me write it here, conduction system. In a heart, we have a conduction system in which the impulses will start from here. These impulses, when they travel from SA node to AV node, it contracts both atria. So these are two atrias, right and left. The SA node is situated near the superior vena cava, and we have a inferior vena cava here. So I told the SA node is situated near superior vena cava, and the impulse starts from here. That's why we also call it a pacemaker. So impulse start here, it starts traveling and it travels to AV node. So during this travel, this atria contracts, and once it reaches there, and then from here it goes to bundle of hairs, and then it spreads to ventricles and make this ventricle contract. So it spreads through a Purkinje fiber. So there is a Purkinje fiber. So the rhythm we get is P. P is the atrial contractions. We get QRS, which is a ventricle contraction, and T is the time when the ventricles are filling. So it's like a resting time. It's a repolarization. So this is depolarization, this is depolarization, this is repolarization. We call it a normal sinus rhythm. Let's talk a little bit abnormal rhythms here. So if we talk about the atrial rhythms, the atrium, we have atrial fibrillation, atrial flutter, and supraventricular tachycardia. In atrial fibrillation, actually the atrium is contracting very fast. This atria contracting very fast, but the ventricles are contracting normal. So let's say it's the atrium contracting fast, these two atrium here contracting very fast, very fast, very fast, and then you have a ventricle contracting, right? Then your atria contracting very fast, ventricle contracting. Ventricle is normal. So because these are contracting so fast, you don't get any P wave. So in atrial fibrillation, actually there is no P wave. Remember that there's no P wave in the atrial contraction. Okay, so then we go to the atrial flutter. In atrial flutter, the same thing, the atrial is contracting very fast, not so fast like a fibrillation, but we call it as fluttering, right? So it's a fluttering, it's fast. So you see so many P waves, 1, 2, 3, 4. It can be 5, it can be 6. And then you see QRS, ventricle contracting normal, atrial contracting fast, atrial contracting normal. In this both cases, actually, because when it's contract fast, it does not squeeze properly, so the blood still remains in the atriums. So what's going to happen when the blood remains here? There are chances of clot formation. In this both cases, the clots can form, and those clots can actually travel and can cause a stroke, can cause pulmonary embolism. So as soon as we find these rhythms in a patient, we put them on anticoagulants. Then we have a excuse me, we have a supraventricular tachycardia. This rhythm actually starts is above the heart chamber. So it's like the rhythm start in the atrium, but it makes the heart faster. So heart beats so fast. So heart will beat very fast. Both atrial ventricle contracts very fast. So you get this kind of rhythm. And this can happen even in normal people many times. It just, some conditions triggers this SVT. So what we have to do is we need to stop this rhythm, because when it is beating very fast, actually it's not squeezing properly, so the blood is not reaching to the brain because it beat fast, so it does not contract properly. So ventricles are not contracting properly, atrium is not contracting very properly. So basically the brain is not getting enough blood, so we kind of have to stop this rhythm. So what we can do, we can actually, there is a we can do Valsova maneuver. We can actually tell the patient to try that. If not, we have a medication, we call it adenocard. I'll write it here, adenocard. This medication is given IV, and when you're giving this medication, this will stop the heart for a few seconds, and then heart will start again. When heart starts again, we are assuming the heart will start with a normal rhythm. The other treatment we can do is a cardioversion. In this, we give a shock to this patient. We give the sedative, right? We are not giving shock like when he is conscious, but sorry, we give him anesthesia and then we give him a shock. But we have to make sure we are not giving shock at T wave, right? This is called a synchronized shock, and as a cardioversion, the other name is cardioversion. So we schedule it and we turn the switch on to synchronize, and that way the shock will not be given at T wave. We don't want to give a T wave because T wave is a resting wave, right? If you give shock on T wave, then it will make the heart stop completely, right? So we don't want to do that. So these were like atrial rhythms, and we have a ventricle, and we have a ventricular tachycardia, in which the ventricle is beating very fast. When the ventricles beat very fast, you get this kind of rhythm, right? So this is VTAC. Remember this by heart. The treatment for this, when we say it's a pulseless VTAC, when the patient is not conscious and you try to check the pulse, there is no pulse, the only treatment that time is a shock. The other name for shock is defibrillation. You give the shock, and then when the heart stops because of shock, and we are assuming when heart starts again, it starts with a normal rhythm. Ventricular fibrillation, when the heart is beating, the ventricle is beating so fast that even you don't see any rhythm. It's not even beating, it's like a queering, right? It's a queering. So that's what you get it. That's a defibrillation. The only treatment for defibrillation is shock. The only time you can save the patient is with the shock. So let's see, if you do not have a defibrillator right now with you, then you tell somebody to bring that, and meanwhile you start doing CPR. But remember that the only treatment you can save the patient is with the shock, right? The shock is the cure for ventricular fibrillation. Then we have a third rhythm related to ventricle is asystole. Asystole, when the heart is not beating at all, you get a straight line, which is not good. We do not shock this rhythm because there is no current in the heart. We start with a CPR, right? So that's what the treatment for this. All those rhythms with the ventricle, VTAC, VFib, and asystole are a lethal rhythm. We need to call code blue for this, and we need to take action immediately. Okay, if you have any question, please contact me at nclexinternational.com. Thanks. So I will end my video here.